Do you struggle with blood pressure, blood sugar, and erectile dysfunction? Namaste. Welcome, gentlemen. It's Anita Tadavarthi. I'm a licensed acupuncturist for the past 20 years. I've treated 100,000 patients in my lifetime. I most definitely have seen this pattern in my practice and want to share with you a simple self-care acupressure protocol you can do at home. I ran a free clinic in India at a chain of clinics on the West Coast, and I established a clinic here in the Washington, D.C. area. In all three places, I saw how the impact of blood sugar and blood pressure can cause or can contribute to erectile dysfunction. It could be due to blood pressure, it could be due to blood circulation, or the damage to the blood vessels. Before I step into it and explain to you a simple protocol that you can do that can help you, it is really important to me that I know that you are working with your medical doctor. For blood pressure issues, there are certain medications, and I want you to be monitored by your medical doctor. And for blood sugar, glucose is key to monitoring, as well as having that adequate insulin. So please partner with your doctor along with this self-care acupressure protocol. The protocol that I want to share with you today is simple. One acupressure point, and it is located below the knee. I treat in zones, but if you want a specific acupressure point, it relates to stomach 36. This acupressure point can be helpful for blood sugar and blood pressure. From a Chinese medicine point of view, when we talk about blood sugar, we want to help activate the spleen, stomach, and sometimes liver and kidney meridians. I'd have to do an intake to see specifics. But if we are activating acupressure point stomach 36, then we can work towards that relationship of stomach and spleen, helping you with blood sugar. And then also stomach 36, if you look at the mirror imaging that is here we have Adam and stomach 36, this area also helps with the heart. And that way it can help with blood pressure issues. So how I want to do this is, of course, with nasal breathing. Nasal breathing can also help with blood circulation and blood pressure issues. Now, if you've been with me, you know that I want you to pick a nasal breathing that works for you. How I do it is I breathe from my abdomen or my chest in a seated down or laying down position. And I also breathe from one or both nostrils with my mouth closed. It's breathing from the nose. And the speed at which you want to do it is totally up to you. If you do rapid nasal breathing, you don't really need to do it more than a minute or two, especially with the acupressure point. But if you want to do nasal breathing slower, then by all means do it slower, and you can acupress that point slower as well to pair it up. So what we're going to do for the next minute is that I'm going to do nasal breathing in the background, and I'm going to show you on my lower leg how I would acupress it. I'm going to do it in a crossed leg position for demonstration purposes. But when you're doing this at home, especially with blood pressure, consider not doing it in a crossed leg position, but really up to you. Find a protocol that works. You'll see these results along with your doctor's recommendation, and you'll know if it's working for you. So for the next minute, follow along. You'll hear me breathe in the background, and you'll see me do it in a crossed leg position, but do what's comfortable for you. Here we go. What I want you to do is to go from the knee and on the lateral aspect of either knee, preferably if you can, do both knees, but we'll just do for demonstration purposes one knee. What I want you to do is go from the knee, and I want you to fall into a natural usher point or a tender spot on the lower leg on the lateral aspect. And then what you can do is one of two things. With the nasal breathing, you can acupress just like this, or you can acupress in a circular motion. It really doesn't find a therapeutic difference between a circular or a counterclockwise motion, really up to you on your comfort. So for the next minute, you're going to hear me do nasal breathing in the background, while we acupress around the area of stomach. 36 for blood sugar and blood pressure issues. And here we go. This is a really relaxing point. Do your best to do this in the morning and evening. And also you can do it throughout the day, work with your doctor. This is a great lifestyle point. So I really encourage patients to do this always. But if you are feeling good along with your doctor's recommendations, then you'll know when to stop. And after a few weeks to about a month, comment down below. Let us know if this is working for you. Also, if there's a topic that you want to know more about, also comment down below. I did this video because many of you requested it. Lastly, we're doing great things at Empirical Grace. All the monetization money from TikTok, Instagram, and YouTube is being used to raise money for a free clinic in the Washington, D.C. area. We're super excited. And we also want to invite all of you to join when we're ready to open the doors. But first, we got to raise a little bit of money. If you want to give a donation, please review the first link in the description or the first link in the link tree. Thank you so much for watching. Thank you for believing in me. Till next time, I wish you all the best in being a man on the planet. It's Anita Tadavarthy. I want to use my 20 years of clinical experience in giving you the best of self-care acupressure protocols to help you along the way. Please comment down below and let us know if these protocols are helping you. Most patients report that they see results within a few weeks to a few months. And if there are topics that you want to know more about, comment down below. Your feedback shapes our content. And also want to give you a special message that we at Empirical Grace are doing just amazing things. We are putting the monetization money from social media towards establishing a free clinic in the Washington, D.C. area. I am from the Washington, D.C. area originally, and this has been my lifelong dream. So just know that as you watch our videos, the monetization money is going towards a great cause. And if you want to donate, you can do so using the first link in the bio. Thank you so much for believing in us, and I wish you all the very best in being a man on the planet. From your friend and acupuncturist, Anita Tadavarthy.
We would like to thank Anita's friends and business contacts who donated their time, money, and medical supplies to the Rapely Free Clinic.
We're here in my grandfather's marriage home, which has now been converted into our clinic or free hospital. We have been here for 4 months, and we have treated about 1,000 patients with over 8,000 or 9,000 patient visits. Most of the patients are farmers and agricultural workers, so a lot of the things that they're dealing with is pains, lots of different types of